Good afternoon, everybody. Today is October 16th, 2020. This is the Falmouth Health Department's weekly COVID update. My name's Scott McGann. Our phone number is 508-495-7485. Our email is health@falmouthma.gov. And the town's website where you can get COVID information and links is falmouthmass.us. So let's see where we are this week. This week we have, since the beginning of the outbreak, which started the pandemic since the 19th of March, there's been 287 confirmed cases. And those are the individuals who have received a positive molecular viral test result. There's been 16 confirmed cases during the time period from September 27th to October 10th. The state, when they do the color chart that we'll show before, that shows you whether you're in the gray, yellow, green, or red, is taking the 2 full weeks prior to the Wednesday's posting. So between September 27th and October 10th, I think there was 15, actually not 16. It's a typo. And that where those cases are coming from, there's local transmission, a few of those, a few out of area sort of travel related, and also an increase in asymptomatic positives. A lot of that has to do with people going in and getting, hip replacement, knee replacements, treatments of some sort, colonoscopies, et cetera, having to be tested, and a few of those are coming back. And we'll talk about testing in a minute. About 97% of all cases are no longer in isolation. Falmouth has been right around 14 to 15%, as low as 13% of all cases in Barnstable County, with 14 based on population being expected. The VNA and the Contact Tracing Collaborative, with the support of the Health Department, the CTC is the state level, VNA is our local nursing service, and the Health Department, we're all doing the isolation and contact tracing. So that hasn't changed. Our weekly case trend, as you can see, that this week we had, this is done on Friday to Friday. We were at 5. We had about 9 last week, and we had about 5 this past week. So when I gave you this presentation last week, we had 282, and then we go to 287. That's 5 cases. So that's a fairly good week. That's sort of an average week for us since about late May, early June. As you can see, we've been averaging for the most part in any given week less than 10 cases a week, which is pretty good considering our population and the amount of testing, which I will cover in a minute. This is the chart of graphing all cases by total number of cases, and you can see that early on we get really, really fast in April, and then we leveled off, and then we tick up, and then we level off and tick up. I hope we're at a leveling off, and we get into the 5 or less cases that we've seen. If I go back, there's been some weeks where we've seen 0, and some weeks where we've seen well less than 5, and just hope that we've got a trend to go back to less than 5. It is tricky to do, as you'll see in a minute when we talk about total number of cases, total number of tests as well. Here's the chart. You can see a lot more red, which is greater than 8 cases per 100,000, so there's a lot more cities in red. Falmouth is in green. Most of the Cape is either in green with a few communities. Looks like Barnstable, Bourne, there's a couple surrounding communities that are in the yellow. Our closest communities are Nantucket and Plymouth, which are in the red. We have been in the green or gray since this chart was started, which was sometime in, I think, August. And hope every week and every Wednesday at about 6 o'clock, the state does the weekly updates on Wednesdays takes until about 6 o'clock for them to post it, give or take. And just hope we remain either in the gray or the green as much as possible. So this is the chart I want to talk about a little bit here. This is Falmouth specific, Barnstable County specific. So each week, this Wednesday chart, when they come up with the state map, you can see that our best couple of weeks were in late August, and we've been averaging between 2 and 3.4 per 100,000. Anything over 4, which is about 18 cases in that 2-week span, would put us into the yellow. So we're not far from yellow. We're in a heavy green, so to speak. We are trending a little bit better over the last week or so. Like I said, we had 5 over the past week. If you look at the number of tests, which I find interesting, back when we had a lot more people here in the August and stuff like that, a lot more moving parts, there was actually less tests given out. Right now you see 2,409 tests done over 14 days. That's 1,200 a week. The key number, of course, is the percent positivity. You want that less than 1. You can see that at all our time since 8/20 to 10/14, we've been less than 1%. So that's a real key number. 0.66 is what our percentage was over that 2-week span, which would have been the very end week of September and the first week of October. And you just want to see that number stay below 1. That's a very good indicator. Okay, so we are trending a little bit lower. and hopefully it will remain that way. Barnstable County has been relatively, we've been around that, maybe a little higher on one week and a little lower on the other, but we're kind of tracking and similarly with Barnstable County. This week they were 3.2, we were 3.4, they're 0.88, we're 0.66 for positivity. Total number of cases in Barnstable County for that same week time frame was just under 100. One interesting thing, if you can see, the state is at 8.7 and in the red. So the state of Massachusetts would actually be in violation of their travel ban. So one way to look at that is, we talk about people traveling from a higher risk state to Massachusetts that they need to quarantine and self-isolate. Actually, to help lower the risk, if you're traveling within Massachusetts at this point in time, you're in a higher community. And we're not asking that people do that. You can't really... We're not asking if you're quarantined if you drive to Fairhaven across the bridge, but to put it in perspective that you need to be careful while you're in Massachusetts as well, because you have all those communities going back. Look at the red communities. So you have some higher infections. So if you look at the New Bedford, Fairhaven, Acushnet, Dartmouth area, up around the South Shore, the North Shore around Metro Boston, over in the Worcester area, and over in the Springfield area, those are the areas are higher risk. And so this map you could utilize as you're traveling as well. If you're going to if you're going to Mashpee, you're at a lower risk than you would be, let's say, in Plymouth. So, so to sum this up is, I like to see the numbers get, below 2. I'd love to see us get back in the gray, but in reality, we are at 0.66. It's going to be hard for us to get in the gray. Less than 5 cases when you're doing 2,400 tests. You tend to catch more because you're not testing people based on symptoms. You're testing them for random treatments and things that are going from medical procedures. You're also doing a lot higher testing of more frequent testing than earlier on of healthcare workers. And so the more routine tests, the more that we get some asymptomatic positives. We're still in the green, and that's really still good. So getting to Barnstable County, you can see that Barnstable County's actually had a fairly good week over the last few days, 2, 0, and 5, way at the far right. They were in the upper single digits to low double digits between, let's say 8 and 13 for about a week long or so, and now we're at the 0 and 5. Hopefully, we want to be obviously the less the better. A little over 2,100 cases. That is the confirmed and probable, with 178 total deaths in the count since the beginning. Barnstable's case, this is from the daily dashboard. You can get this every day. When I talk about the state website, there's been 5 cases, Thursday, October 15th. See other communities like Middlesex, other counties, Middlesex, Suffolk, and Essex have been where a lot of the cases have been, and that sort of continues. No deaths yesterday in Barnstable County. The dashboard, again, 4 o'clock every day. You can look it up. That's what I do. The cases have been higher, no doubt about it. We were in that couple hundred range, 300 range. Now we're in those 4 to 7 range on a given day. The deaths were the last week or so in the low teens, 23 for this particular day. Total deaths have been 9,452. Averaging about 15,000 tests a day, with about just under 5 million total tests administered since the beginning, with about 2.4 million molecular tests. Our status hasn't changed. We go that positive or in progress trends continue. We still have not gotten the death below. And actually, if you compare it to, there was an article in the Globe, if you compare it to New Jersey and New York, we're averaging more deaths than those 2 states are. I'm not quite sure why. I don't know everything that's going on, but that has been a trend in the data that I think our deaths have been higher than a lot of states have been. And why that could be that we're still having issues with our nursing homes. It might be, hopefully we're all consistent in how we document it as well, too. So, for example, if somebody tests positive in April and a nursing home, and then later on, 4 months later, something else, and they pass away, we wouldn't necessarily call that a COVID. I don't know whether the same definition of a COVID death is counted the same, and not quite sure why, but to me, it's something that I have noticed in the daily dashboards, because I do check other states as well. Looking at our percent positivity is a bit higher. Again, you want that less than 1. Our lowest observed value was 0.8 back in early September, and we're at 1.3, so we're 70%. That's not good. That trend needs to go down. We are increasing in cases and increasing in positivity. Not at a point, where I think the governor's making changes yet. I mean, he actually went to step 2, phase 3 couple weeks ago. But obviously we want to see that number down. Deaths were at the lowest was 366, actually 302 early in, I think, late August, early September. We've been staying now right around 500 hospitalizations on any given day. Surge capacity sort of been fluctuating. We don't have to worry about that one. And then deaths have been in the teens, consistently in the teens. And hopefully we can get that way down. Our lowest observed value was 9 on average, our average. And so that's been on a little bit of a high stake. Obviously, more hospitalizations, you're going to see more intubations. You're going to see more deaths with more hospitalizations. Not at a point where it's like going off the chart or anything like that, but you do see the increases. And we are getting into colder weather. People are a little bit more lax, maybe, because it's been a long 7 months. And with the cooler weather and things of that nature, and colleges open and things like that, we have seen some more cases. So that's where we're at. As far as hospitalizations, we've been right around 500 for a couple of weeks, plus or minus. We were down a lot from June 26th, but we're actually up 128 from September 25th. So those are 2 dates that I happen to have chosen. I'll track each week as sort of early on, mid on, and so forth. So we're about 500 cases plus or minus. Cape Cod Hospital did have a few cases last week. They're at 0 this week. Falmouth Hospital has 2 hospitalizations. I didn't see any today. Yesterday's data showing any in the ICU. There was some ICU here and there, 1 or 2 over the last couple of weeks. So the hospitalization is still in fairly good shape, although there's been, like with the state and having more hospitalizations, we have seen, we were pretty much 0-1, 0-1 for most of the summer into the early fall, but now we're starting to see maybe 2s and 3s and 4s here and there, so there has been a bit of an uptick in hospitalizations and ICUs. As far as ICU, again, 92 was on the 15th. We're up 15 from September 25th. We're up 5 in the daily intubations, at least from September 25th's data to today's data, but down generally from June, about 80 daily intubations. Long-term care is still an issue. So you can see here that on October 8th, we had about 6,168 deaths from long-term care. We're at 6,236. So that's roughly 70 of the deaths over the past week were associated to long-term care. Our long-term care facilities have been doing well, knock on wood. These numbers really haven't changed much. Our nursing facilities, our long-term care facilities seem to be doing quite well right now. Let's hope that continues. As far as COVID testing, nothing's necessarily changed. Things will change on it quick, in short order, I think. Right now, you still go through the drive-through by appointment, contact the Cape Cod Healthcare's dedicated call center, 508-862-5595. You can also go to the East Falmouth CVS. The walk-in clinic, like the Convenient MD, is doing a lot of testing. There's also the Community Health Center of Cape Cod located in Mashpee. And you can go on mass.gov COVID-19 testing, and that is for the PCR test. I don't think we're far off from getting a rapid test PCR. The school department has offered a one-time test for a saliva-based sent to a lab PCR test that is not FDA approved, and I think we're sort of working with them to try to get approval, and you need to have a lot of tests and a lot of vetting of a test. And it'd be nice to, if any of the teachers want to elect to do it, it's for the greater good, I think, is to not only get yourself a baseline of how you are at that particular day, but it also helps us as a society work towards getting a accurate, cheap, and fast PCR test. If we can detect viral DNA quickly, cheaply, and frequently, and then we're in a lot better shape if we can be testing people on a much more frequent basis. The PCR test that we have now does take a little bit of time, and maybe this will help us get to a point where tests become a little bit more readily available, or they are readily available. We are testing 1,200 a week, but maybe more rapid is what our issue is right now. Because when you go to get a test, you shouldn't be traveling around and things of that nature. So you want to stay home waiting pending your results if you're being tested, if you're symptomatic and being tested, of course. A little bit about testing again. Antibody tests tell you you've had a previous infection and you have antibodies towards that infection. It is not important for contact tracing purposes. It just tells you a previous one. The antigen and the PCR are much more of a current infection, with the antigen being less accurate. I've heard up to 30%. So when you get an antigen positive, you would want to get a PCR to verify it. Obviously, treat the antigen like a positive. We do as we contact trace, even though the state considers it a probable, not a confirmed case. You still want to make sure you treat it until you get your results of your PCR. You still want to treat yourself as positive. It's not like it's that inaccurate. I mean, 30 might be a little high, but that's what I've heard. But it does tell you it's quick, it's fast. There's a CareMark Center in Dennis that does it. Ideally, we would want to do PCR, which is the confirmed, the one that you get at Cape Cod Healthcare or you get over at Convenient MD. But it does take at least 24 hours to several days to get your results. So it tells you have active or recent infection. One disadvantage with PCR is that you will show that virus probably for several weeks, even though you're not symptomatic and not spreading it, just because it's such a sensitive test and it's still picking up some viral RNA or DNA. It's still the gold standard. So the goal is to get something that's as quick as an antigen test, but as accurate as a PCR and done cheaply, and so that you can buy them by the thousands and you can do them in your workplace or whatever, but we're just not at that point. Just hopefully we get there soon. Flu shots. Good news is, I give good news when I can, is that I guess everything I've read on the Southern Hemisphere, flu season is what our summer is, and it's because it's their winter, that it's been the lowest flu season that they've seen in recorded history, which would make sense because they're doing the social distancing and masking is going to work on any particular type of respiratory virus. That being said, obviously, we don't want to be confusing things. You're not going to know whether you have COVID or if you've got the flu, and so getting your flu shot, and school-age children will have to get it by the end of the calendar year. So flu shots are something that you need to consider getting this year, and you'll have to get if you're in school, the Falmouth Public Schools, or actually I think any school. You can get it at your local pharmacy or your physician, okay? We at the Falmouth Health Department with the VNA, we're sponsoring it. The VNA is going to execute it. We'll be there to help direct traffic, but there'll be VNA nurses. There'll be 4 of them there. It will be October 26th from 2 to 5 p.m. Rain date is November 2nd from 2 to 5. Hopefully I don't have to call everybody back to tell you that we're going to the rain date. Hopefully it's a nice day. It'll be outdoors drive-through at the Gus Candy Senior Center parking lot. It's by appointment only because we just can't have 100 cars show up in the first 5 minutes, and then we're backed up all the way to Town Hall, all the way to the rec center. So we're doing it by appointment. We've got some slots left. I think we've filled up most of them, but we do have slots left if you hear this and you call. We wanted everybody registered by today. If you do hear this and you hadn't registered and you want to get it, give us a call on Monday. We just like to get a good number for how many vaccines we need to bring and how we're going to make the traffic flow and so forth. So if you call 508-495-7485, which is the health department, we'll schedule you. Before you arrive, you would need to print out the consent form. You can get that on our website or here at Town Hall in the front if you come in here, but you can also get it from the health department's webpage. Click on flu, you download and print the form, have it filled out. Obviously, if nobody fills out the form, it clogs the line up, so I just want to have everybody move through quickly. You want to bring your insurance card. No copay for that. Uninsured children under 18 are eligible for free vaccine. I just picked some of that up this week from the state. Make sure you wear short sleeves. Try to make it easy on the. There'll be a nurse on either side of your car. There'll be 2 lines. Eventually, there's 1 line to get in, and then we'll split the 2 lines between the 2 nursing stations. Nurse on the left, nurse on the right, on both. So there'll be 4 nurses to take care of 2 nurses per car to take care of each side of the car. So make sure it's easy, that you don't have to get out of the car, take off your sweatshirt, and so forth. So we want to make it easy, and so we can get everybody in and everybody out. Also, leave your pets at home. Certain dogs are not going to like the fact that somebody's grabbing your arm and giving you a needle. We don't want a dog over there being upset. So you want to make sure you do that. And then we'll have you drive out. So one of the main things that we've been getting is, do we have the high dose? The high dose has been a little tricky to get this year. Cape Cod Healthcare, the VNA is part of Cape Cod Healthcare. It had gotten a limited supply of the high dose and has allocated that elsewhere, not to the town clinics. So right now we have the single dose, quadrivalent, which is designed to protect against 4 different viruses, available. It's been hit or miss for the different pharmacies locally and physicians' offices to get the high dose. It's recommended for those over 65 that are very vulnerable to it. So it's not necessarily if you're a healthy 65 that you're not going to get any benefit, or anybody's not going to get any benefit from the single dose. But there's been a high demand this year for the high dose, but the availability has not been there. Health departments are on the open market just like any other entity like CVS or CVS or Walgreens or any of the other pharmacies. It's not that we have a special line or track towards them or I didn't want them. It's just what's available. And so if you definitely need the high dose, I talk to your local pharmacies or talk to your physician to see if they know there are any available. Otherwise, you're welcome to come to if you haven't scheduled it yet, please just call us by Monday so that we know how many vaccines to bring. And so that's it for the flu shots. Again, 508-495-718-485. I was going to do online registration, but that only works, not everybody is on, it's got the computer going and are on the internet. So just easier, just call us up. It take about a minute on the phone, and, we've already scheduled, maybe 150 people so far, so. As far as where we are right now in terms of the governor's phases, we're still in phase 3, step 2. We moved that up. Indoor gatherings are still limited to 25 people max and 8 per 1,000 square feet of any continuous indoor space. So that means this room I'm in, the Selectmen's Meeting Room, I think has a maximum of 8. It's right around 1,000 square feet. So, that's sort of where the gatherings order is. Outdoor has been raised from 50 to 100 in lower risk communities that we are, from 50. So, not much has changed in that in the last few weeks. Social distancing, again, is still something that we have to. We have schools meeting in person. We have our numbers are still on the scheme of things low. And that's got to do with people doing social distancing and face coverings and not having large gatherings. That's what does it. It's, nothing magical. It's still quarantine upon travel because most of the time when we start seeing the blips, it's been brought in. So continue with the social distancing. We'll continue to follow up on complaints. We do as many as we can. We do actually do all of them at this point. Early on, it might have been a little tricky to do the 150 to 200 calls we might get in a given day, but, we got to as many as we could. Now we can pretty much get to them all, and we'll follow up, because obviously the last thing you want to do is undo the hard work that we've done to this point. Again, as a recap, state metrics are on an increase. Countrywide, it's on an increase in general. Falmouth cases remain pretty stable, right around that 6 to 8 cases a week. I could have lowered that to 5 over this past week, so between 5 and 8 a week. And we're in phase 3, step 2. So again, I'll do another update, and if you need a flu shot, definitely give us a call as soon as you can. And I'll see you guys next week. Thanks.